Thank you for checking out this video. I will be talking about some considerations in the naturopathic treatment of migraine headaches. Back in medical school, one of the things that might bother us students to learn is these different types or classifications of migraine headaches. But regardless of what someone has, whether it's a common, classic, or complicated migraine, these categories can often be hard to put people in, but are not really clinically relevant. In other words, even knowing what type of migraine someone has, that's just classifying symptoms. That has pretty much nothing to do with understanding why that individual has migraines and what to do about it. Conventionally speaking, there is no known cause of migraine headaches. However, we do have several theories on different factors that can contribute to migraines. One is vasomotor instability. This is basically saying that there is dilation and compression of blood vessels going into the head area, and this will reduce blood flow to certain areas, resulting in pain. Therefore, as we go through some treatment options, we'll see some of them can relate to working on blood vessels and blood flow to the brain. Another theory is of increased platelet aggregation. So platelets are in the blood, and they're what causes blood clotting when you have a cut. Well, there's a theory that there's too much aggregation, and this can also be related to serotonin, as serotonin, mostly known as a neurotransmitter connected to depression, well, it works throughout the whole body and is associated with platelet aggregation. And there is therefore also some agents that might help prevent this. Aspirin and herb feverfew has been theorized to work on headaches this way, essential fatty acids. This leads to a serotonin deficiency theory because there are some people, at least with just symptoms relating to migraine headaches, might feel better on certain medications that affect serotonin, specifically the SSRIs or the psychiatric drugs that work on serotonin, or they might do better taking 5-HTP, which is an amino acid supplement that's a precursor to serotonin. But this certainly is not universal, and there are certain people with migraine headaches who are the total opposite. You give them some 5-HTP, and they get much, much worse headaches. So this is just something that might help some people, but hardly for everyone. Another theory is that migraines are related to a nervous system disorder, that when someone becomes stressed out, what kicks in is the sympathetic nervous system, or the fight or flight response. Nerve cells release something called substance P, and that causes vasoactivity within the cardiovascular system, so you start getting that constriction or relaxation of different blood vessels, and that might affect blood flow to the brain, causing a headache. When it comes to the type of work that I would do, or I think most naturopathic doctors would do with someone with migraine headaches, is going to primarily be about working on underlying problems, not so much about trying to fiddle around with biochemistry based upon these very focused pathways. There are triggers that can lead to migraines. That could be food sensitivities, environmental exposures. Stress can play a big part of it. And while it's nice to understand these theories and how different supplements or medications might be palliative for migraines, vitamin B2, magnesium, feverfew are some of the most known ones, the treatment should not be limited at simply being palliative. You want to treat the underlying cause, and for most people, that's going to lead into healing the gut and detoxification. When we get to foods, there are allergies and sensitivities. An allergy indicates that there is an immune system response, an immunoglobulin response to an offending agent. A sensitivity is a non-immune system response. For example, lactose intolerance is not an allergy, that's lacking of an enzyme to break apart lactose. Someone can have symptoms, but it's not an allergic response. When it comes to these foods and headaches, they could trigger migraines through allergic responses or through sensitivities. It really doesn't matter if you have a migraine. You want to find out what foods are causing migraines to happen. And sometimes they're just additive agents, like MSG. But it can be helpful to work with someone to try to figure out what's going on with these foods, to be aware of the foods that are primary triggers in most people. Sometimes you're going to have to do like a diet diary or a journal to figure this out, because again, they're not all food allergies. So even if you got all the food allergy tests and they were correct, they still might not show you exactly what's going on. We have certain dietary amines. This is more specifically histamine, but there are other vasodilators that might be in the food you're eating, and that's causing blood vessel constriction and dilation, leading towards migraines. Alcohol, red wine, chocolate, cheese, beer. These are the most well-known ones that lead to this. There are some supplements that help: vitamin C, B6, quercetin, other antioxidants. But this is also the type of thing you're going to figure out by closely looking at your symptoms and what you eat to see if there's a relationship. This is just a list of some of the more common supplement treatments. Again, these are best used to palliate symptoms. These aren't really designed to get to the underlying root cause of why you have a migraine headache. And these are often the type of things, or if you just Google, migraine headache, supplements, whatever, you're going to come up with these. Fish oil or antioxidants, again, magnesium, that can be very relaxing. It's best to get an IV, which is impractical. The second best way to get it is an Epsom salt bath. Pills may or may not work that well. Vitamin B2 or riboflavin, after a month, that can help people out for headaches. Feverfew, butterbur, those are some more of the common herbs. Folate, 5-HTP, discussed briefly before. There's a lot of physical medicine that can help, and tension, posture, that all plays a big role in headaches. I'm not covering in depth here because I'm going over things from a different perspective. But it's always good to consider that physical aspect and possibly working with someone, whether it's a chiropractor or getting a massage or doing certain stretching exercises to keep the upper body and neck area relaxed. From a naturopathic perspective, migraines are a sign of a deeper problem within the body. The goal is not to treat the migraine, the goal is to treat the whole person. And whether you're going to a naturopathic doctor for a migraine headache, because you're tired, be because of a skin rash, whatever it is, from minor symptoms to severe symptoms, the job of the naturopathic doctor is to go through your history and help you work on the root underlying cause, not to say take this supplement for this symptom or whatever. And really, not just with migraines, but with many different symptoms that people have today, many different diseases, the root problems are going to be with impaired digestion and toxicity. And that has to do with the type of world that we live in, the toxicity exposure that we have, and the foods that most people eat. With this chart, I'm just borrowing from Chinese medicine for a moment. Within 5 elements theory, there are basically 5 different types. Each type is associated primarily with an organ system and some key symptoms. So there is the wood type that's associated with liver and gallbladder symptoms, and symptoms are going to be related to tension and constriction. So people who are very tense, possibly quick to anger, having problems with anger and irritability, that tension can lead towards symptoms including headaches. Another constitutional type, a water type, will be associated with kidney and bladder symptoms. But in these people, there might be weakness causing lack of water, loss of electrolytes. So through another mechanism, you can lead to migraine headaches. So very simply here, we can see how different problems can lead towards very similar symptoms. And if you're working with a practitioner who is able to recognize the difference between you and someone else, the wood person might get one treatment that's related to tension and constriction, helping the liver function, and the water type person might get a very different type of treatment, which is again related to the kidneys, water fluid balance, and electrolytes. I'm going to talk briefly about leaky gut. Leaky gut is the theory that we have particles in the digestive system, whether they are not fully digested foods, whether it's toxins released by candida or other bacteria. It could be toxins that our liver has detoxified and now are trying to travel through the gut for elimination. Well, regardless, the theory is that these are being reabsorbed through weak or permeable membranes in the digestive system, get back into the body and cause myriad of different symptoms. I'm just going to say here that leaky gut is not a specific diagnosis. There's no real specific lab test for leaky gut. I know there are certain practitioners who run lab tests for GI permeability, but leaky gut is more of a general phrase to describe what many people in natural health believe is happening. But what it really comes down to, the bottom line, is that there are many different symptoms that lead back to poor digestive system health. And whether through giving agents that shore up the membrane in the digestive system or just flat out eliminating different toxins that can be in there, we can get relief of symptoms. And if for certain people, if the toxins coming in there are going to add to vasoconstriction and vasodilation in the head, then we could start seeing a contribution towards migraine headaches. There are what's called functional labs that I want to go over. Generally, functional labs are the type of test that you'll get by going to, say, a naturopathic doctor or maybe an integrative medical doctor or other people who are working from a more holistic perspective. These are typically not lab tests that you're going to get by seeing a conventional medical doctor, and generally they're not going to be covered by insurance. But they can give a lot of insight into the underlying function of what's going on inside the body as compared to the conventional lab tests, which really aren't designed to look at how healthy someone is or what's going on causing disease. They're more designed to find actual pathology and diagnose it. Well, there are 3 tests to briefly touch on. One is a stool analysis, and there are different labs that do this: Diagnostic, Genova, Doctor's Data. There are some others. They're all pretty good, but through some stool samples, you can get a lot of information. They can look for parasites. They can culture out different bacteria, fungus. They can test for markers of inflammation in the gut, markers of pancreatic enzyme production. You can get a ton of information through these stool analysis tests. And from a functional perspective, it's much better than doing nothing and waiting for something bad to happen. Often the conventional medical doctors and the gastroenterologists, they seem to be, in my opinion, fixated on giving endoscopies and colonoscopies. Not that there is no place for colonoscopies, but a colonoscopy is really just there to diagnose a severe pathology within the colon. It is not a functional assessment of how healthy your digestive system is working. Whereas if you go to a practitioner who uses these tests, you will get much more of that assessment of are you healthy, are you not, and then markers that will help determine what specifics you can do to improve digestive system health. Porphyrin testing and hair analysis are 2 types of functional labs that I use at times to determine the degree of toxicity within my clients. There are many different types of toxins out there in the environment that are impairing health. Heavy metals like lead, aluminum, mercury, plastics, which our drinking water seems inundated with, especially people drinking out of plastic or eating food microwaved with plastic. Then we have pesticides like biphosphate, many different persistent organic pollutants. To just run through this would be a whole other presentation that can go on for an hour. But we just have to be aware of the degree of environmental toxicity and look at lab tests that can help determine how bad it is in each person. This is a sample of a porphyrin test. You could read up more on porphyrin testing at doctorsdata.com. To go through the quick analysis of this, these are compounds in the production of hemoglobin. So in order for the body to make hemoglobin, it basically has to take each of these compounds and convert one into the other. Different toxins can interfere with the conversion, and if you see a lot of these spilling out into the urine, it indicates that there is a burden of toxicity on the body. Some of these markers indicate one particular toxin is a problem more than another. So for example, the precursors 1, 2, and 3 indicate mercury, whereas the cursors 1 and 2, those are more likely to indicate persistent organic pollutants. The objective of this test is to have something simple. This is a morning urine test that can be used to measure the degree of burden of toxicity on the body and as a way just to track improvement over time. This isn't a perfect test in that it's not a direct test for the toxins, that you're not directly measuring lead, mercury, aluminum. But the problem with those direct tests is that no matter what way you measure these markers, you're basically measuring how many of those toxins are in different compartments. So it might be interesting to know how much mercury is in blood or how much mercury is in hair, but that's not necessarily telling you the total body burden of those. There is no test out there that can comprehensively tell you how much of each toxin you have in your body and where is it and what harm is it doing. The best we can do is look at these different tests, combine them with symptoms, and surmise what type of toxicity someone has and what they need to do about it. This is the top part of a hair analysis test from doctor's data. I know there are some other labs running hair analysis with different claims in terms of which one is the best. At least in terms of toxicity, I haven't had any problems with doctor's data. There's two parts to the hair analysis. There's the toxic metals, and then there's the trace or essential minerals that people are supposed to have. On the top part here, we can see how much of these metals are being put out into the hair. This is not a measurement of how many of these metals are in the body, and it should never be interpreted this way. You can't look at a hair analysis and say, well, my mercury is this high, therefore I'm this high or lower mercury. We have situations where you might have someone with autism, and their metals are all extremely low on hair analysis tests. That's because they have impaired detoxification and are not dumping the metals out. Nonetheless, the hair analysis test can be a very valuable tool, but it needs to be interpreted with some expertise. You can't just do a straightforward interpretation as if you're measuring the total body load of these metals. So this is the second half of the lab test where it goes over essential and other elements. It's important to have a balance in these. I use a system devised by Andrew Hall Cutler. It's pretty easy to find information on his method of hair analysis online. And he basically says that these essential elements need to be in balance. And he has a system of determining what's in balance and what's out of balance. But essentially, if you have a lot in the red area, or if you, that would be the extremes, or if you don't have enough in the middle, the green area, or if you have all the minerals too high or too low, and that's showing that there's a general mineral imbalance. And his argument is that that mineral imbalance, this derangement of minerals, is caused by toxicity. So he doesn't really want to look into how to interpret the top part of the chart or the toxins until these essential elements are balanced. And I've seen this work out in practice where you run a hair analysis test on someone. The toxic metals might look okay, but there's an extreme imbalance in the essential elements. You work on balancing the essential elements, which could be by taking minerals people need, but it could also be by doing a lot of detoxification. And then the essential elements look better on subsequent hair analysis tests, and then now you actually see an increase in toxins being dumped down into the hair on follow-up hair analysis. So when used appropriately, the hair analysis can be extremely helpful. When it's just interpreted without really knowing what you're doing, you might get some misleading answers. But it's a really good test, and I think consideration when looking at lab tests for migraine headaches, because it will cover the toxicity part, but it can also give some insight into mineral imbalances that can lead to headaches. Does someone have enough, electrolytes just for one of them? Just looking at sodium, potassium, and some of these others, and how it relates to, adrenal function. Just that is helpful in itself. I'm just going to follow up with some general thoughts on proper naturopathic treatment of migraines. Everyone's going to work a little bit differently. So one naturopathic doctor may favor certain functional lab tests, another might work a little bit more based upon symptoms or in-office evaluation. But regardless of who you go to, the goal should be to look at you as a whole person and treat the underlying cause. And as long as someone is doing that, then that's fine. Not everyone has to work in the exact same way. So that being said, some of these lab tests are my way of working with people on some of these underlying problems. I don't want to say everyone needs to have these specific tests. I don't run these tests in everyone. I run them when I think it's necessary. If there's a clear case of toxicity, if there's a clear case of some digestive system issue, if I can get the signs in office, then I might not bother telling them to spend the money on a lab test. Often naturopathic doctors will use homeopathic remedies. Just want to say that while it can work, you're going to get a different remedy by going to someone rather than running off to the health food store and buying some general compound homeopathic with several different remedies in it for headaches. If you see someone who's working with you one-on-one, you should get something that's very specific for you, and not just, a mix of different things together, and hopefully this will work. Although if you do run to the health food store and look for a compound homeopathic, it might work fine for you as a palliative. The same thing can be said for herbal medicine. Feverfew, butterbur, those are great herbs to use as a palliative. But if you go to a trained practitioner, you're going to get herbs based upon you as a whole person. An herbalist is going to care about your constitution, our temperature, dry, damp, tension, relaxation. They're going to consider different organ affinities for herbs. Just even going back to a chart I put up earlier, if someone is more of a liver type or wood type compared to the kidney or water type, they might need very different herbs, even if the symptoms are very similar. So again, you get a very different treatment by looking at this from an individualistic perspective rather than saying what's the best way to treat headaches. In the end, you never want to treat the migraine headache. You want to treat the person and not the disease. And that should be the main takeaway point of this presentation. I think that's it. That's all that I have for this. Any comments, please list below, and I'll put a link to my website in the description. Okay, bye.